Over 60, the only 3 natural ways to lower blood pressure, doctor approved. That title might sound simple, but here is the real question. If high blood pressure is so common, why do so many people still struggle to control it? Today, we are diving into a condition that nearly 90% of adults will experience at some point in their lives: hypertension. It is often called the silent killer, and the reason is straightforward. It usually develops quietly, without clear symptoms. Yet it can cause serious damage over time. Many people assume medication is the only answer, but that is not always the full story. There are proven lifestyle strategies that can significantly lower blood pressure naturally. In this video, I will explain 10 evidence-based methods that I commonly recommend to my patients to help manage blood pressure without relying only on medication. But before we talk about solutions, it is important to understand how blood pressure actually works in the body. When blood circulates, it must push against the walls of your blood vessels to move forward, similar to water flowing through a pipe. This pressure constantly changes depending on what your heart is doing. When the heart contracts, pressure increases and produces the top number, known as systolic blood pressure. When the heart relaxes between beats, the pressure falls to the lower number, called diastolic blood pressure. Although this process is completely normal, consistently high pressure over time can gradually damage blood vessels and strain the heart. In fact, research shows that up to half of heart attacks and strokes are related to uncontrolled hypertension. That is exactly why learning how to manage blood pressure early can make a major difference in long-term health and independence. If you are watching this and thinking, "This sounds like me," you are certainly not alone. Many adults over 60 regularly check their blood pressure and notice numbers that are slightly higher than they expected. Sometimes it happens during a routine appointment, sometimes on a home monitor, and sometimes it appears without any warning at all. The frustrating part is that most people feel completely normal, even when their numbers are elevated. Because there are often no symptoms, it can be easy to underestimate the risk. However, high blood pressure slowly places stress on blood vessels throughout the body, affecting the heart, brain, kidneys, and even the eyes. This is why it has earned the nickname, the silent killer. The good news is that small lifestyle changes can make a meaningful difference. One of the most powerful factors influencing blood pressure is diet. Researchers have spent years studying which eating patterns help people control hypertension naturally. One approach consistently supported by strong scientific evidence is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and despite the complicated name, the concept is quite straightforward. It focuses on eating more whole foods such as fruits, vegetables, lean proteins, whole grains, and legumes, while reducing highly processed foods and excess salt. Many people already recognize these principles as the foundation of a balanced, healthy diet. Studies show that following this approach can lower systolic blood pressure by roughly 5 to 6 points on average. That may not sound dramatic, but even modest reductions can significantly decrease the risk of cardiovascular disease. The key idea is not extreme restriction, but gradual improvement in daily habits. Over time, these choices help support healthier blood vessels, improved circulation, and better overall heart health. One important recommendation within the DASH approach involves reducing sodium intake. Salt has become a somewhat controversial topic in recent years, yet the scientific evidence remains clear for individuals with high blood pressure. If your goal is to control hypertension naturally, limiting sodium to about 2 grams per day can make a noticeable difference. Interestingly, one of the most common mistakes people make when trying to cut back on salt is focusing only on the salt shaker at the dinner table. In reality, the majority of sodium people consume does not come from food they season themselves. Research shows that nearly 80% of dietary sodium comes from processed foods and restaurant meals. A meal that appears healthy at first glance may still contain more sodium than recommended for an entire day. Consider a typical restaurant bowl filled with grains, vegetables, and protein. While it may look nutritious, the sauces, seasonings, and prepared ingredients often contain significant amounts of salt. This is why reading labels and cooking at home when possible can be so helpful. A real-world example of sodium reduction comes from Finland. Several decades ago, the country introduced policies requiring warning labels on foods high in salt and promotional labels on lower sodium options rich in potassium. Food manufacturers were encouraged to improve flavor while reducing sodium levels. Over time, these changes had a remarkable impact. National sodium intake decreased by roughly 30%, and average systolic blood pressure dropped by about 10 points. Even more impressive, death rates from heart attack and stroke declined dramatically, and life expectancy increased for both men and women. This example shows how powerful small dietary shifts can be when maintained consistently over time. Along with reducing sodium, researchers also emphasized increasing potassium intake. Potassium plays an important role in balancing the effects of sodium in the body. If sodium tends to tighten or stiffen blood vessels, potassium has the opposite effect. It helps relax the vessel walls and supports better blood flow. Another advantage is that potassium assists the kidneys in removing excess sodium from the body through urine. This natural process helps reduce fluid retention and pressure within the circulatory system. Many foods naturally rich in potassium are already part of a healthy diet. Bananas, oranges, sweet potatoes, spinach, beans, and lentils are excellent examples. Studies show that increasing these foods can reduce blood pressure by approximately 5 to 7 points. However, it is important to mention that this strategy is not appropriate for everyone. Individuals with kidney disease or those taking certain medications may need to limit potassium rather than increase it. That is why it is always wise to discuss major dietary changes with a healthcare professional. Now let's talk about another powerful tool, physical activity. For many years, cardiovascular exercise such as walking, cycling, or swimming was considered the primary method for improving blood pressure through activity. While these forms of exercise are still extremely beneficial, newer research suggests that other types of training may also be highly effective. A large meta-analysis, published in 2023, examined more than 270 clinical trials to identify which forms of exercise produce the greatest blood pressure improvements. Interestingly, isometric exercises appeared particularly helpful. Isometric exercises involve holding a muscle contraction without moving the joint significantly. Examples include wall sits, planks, and static squats. According to recent research, these exercises can reduce systolic blood pressure by as much as 8 points in some individuals. That is a meaningful improvement for something that requires only a few minutes of practice each day. Of course, not everyone enjoys holding a plank position, and that is perfectly fine. The encouraging message from the research is that nearly any form of regular physical activity can support healthier blood pressure levels. Whether you prefer brisk walking, light jogging, cycling, swimming, yoga, or strength training, the important thing is consistency. Movement helps improve circulation, strengthens the heart, and encourages the blood vessels to remain flexible. Another factor closely connected to both diet and exercise is body weight. When individuals begin following a balanced eating plan and staying physically active, weight loss often occurs naturally. This can have a powerful effect on blood pressure. Studies show that for every kilogram of weight loss, which equals roughly 2.2 pounds, blood pressure may decrease by about 1 point. While that number may appear small, gradual weight reduction over time can lead to meaningful improvements in cardiovascular health. Now let's discuss a factor many people overlook: alcohol. Alcohol can sometimes create the impression of relaxation, but regular consumption, especially more than 2 drinks per day, can raise blood pressure levels. Limiting intake or reducing frequency can therefore be another helpful step for those trying to manage hypertension naturally. Smoking is another important factor to consider when discussing blood pressure and cardiovascular health. Nicotine stimulates the nervous system and temporarily increases heart rate and blood pressure shortly after smoking. Over time, smoking also damages the inner lining of blood vessels, making them less flexible and more prone to narrowing. This long-term effect contributes to increased pressure within the circulatory system. For individuals trying to protect their heart and blood vessels, avoiding tobacco products remains one of the most effective lifestyle choices. Sleep also plays a surprisingly important role in blood pressure regulation. Research has shown that regularly sleeping fewer than 6 hours per night is associated with a higher risk of developing hypertension. Adequate sleep allows the body to regulate hormones that influence stress, metabolism, and cardiovascular function. However, some people sleep through the night, yet still wake up feeling exhausted. In certain cases, this can indicate a condition known as obstructive sleep apnea. During sleep apnea episodes, breathing repeatedly stops and starts throughout the night. These interruptions can significantly strain the cardiovascular system and are considered a common cause of resistant hypertension. Signs may include loud snoring, gasping during sleep, or extreme daytime fatigue, despite spending enough hours in bed. Anyone experiencing these symptoms should consider discussing them with a healthcare professional. Proper diagnosis and treatment can lead to substantial improvements in both sleep quality and blood pressure control. Stress is another factor frequently mentioned in discussions about blood pressure. Intuitively, most people feel that stress must have a powerful impact on the body, and to some extent, that is true. Short periods of acute stress can temporarily raise blood pressure as the body releases stress hormones and prepares for action. However, when researchers study long-term stress, the relationship becomes slightly more complex. Evidence suggests that the biggest influence may not be the stress itself, but the behaviors people adopt in response to it. During stressful periods, individuals may sleep less, exercise less, eat more processed food, or increase alcohol consumption. Each of these habits can gradually raise blood pressure over time. Developing healthy ways to cope with stress, such as physical activity, mindfulness, social connection, or relaxation techniques, can therefore be extremely helpful. Now here is a surprising observation from research that often makes people smile. Studies have shown that pet owners, particularly those who own dogs, tend to have slightly lower blood pressure on average. One small study even suggested that adopting a pet produced a greater reduction in blood pressure than certain medications in that specific group. While this should not replace medical treatment, it highlights how lifestyle, emotional well-being, and daily habits can influence heart health in ways we sometimes overlook. Finally, let's talk about what blood pressure target we should actually aim for. Large clinical studies have attempted to answer this question by comparing different treatment goals. One of the most influential studies, known as the SPRINT trial, compared a target systolic pressure of 140 with a more intensive goal of 120 in adults at higher risk of cardiovascular disease. The results were significant. Participants with the lower target experienced about a 25% reduction in heart attacks and strokes and roughly a 27% lower risk of death from cardiovascular causes. However, more aggressive treatment also increased the chance of side effects such as dizziness or kidney complications. Because of findings like these, many clinical guidelines have lowered the threshold for diagnosing hypertension from 140/90 to 130/80. The purpose of this video is not to overwhelm you with too many changes at once. Sustainable progress happens gradually. Even adopting one healthy habit at a time, such as reducing sodium, increasing physical activity, improving sleep, or managing stress, can create meaningful improvements in blood pressure over the long term. I encourage you to choose one strategy from this list that you feel ready to start today. Share it in the comments as a way of committing to that step. And remember, if lifestyle changes alone are not enough, medications can still play an important role in protecting your health. High blood pressure affects more than 1 billion people worldwide, but awareness and simple daily choices can help many individuals regain control of their cardiovascular health. Stay curious, stay healthy, and I will see you in the next video.